very good morning, everybody, all the participants. I admire your patience. Thus, we'll just start the presentation, the webinar, in a couple of more minutes. I'll request all of you to please go on mute, and if possible, please switch off your webcam so that we may have a seamless webinar for all of us.
Hello everyone. A very warm good morning to all of you on this weekend morning. I'm really admiring that so many people on this Saturday, they are, just log in and attending this webinar. It's really nice to see. And on behalf of Society for Indoor Environment, I, Dr. Radha Goyal, Secretary SIE, would like to welcome you all for this first ever interactive and knowledge sharing international webinar series of SIE. So we have brought this series to you with the objective to bring forth the relevant knowledge and practices in this pandemic era with regards to its impact on human health and environment. The series will also bring to you the combating strategy to help the general public to cope up with COVID-19, both physically as well as mentally, with our eminent speakers, with our experts, academicians and scientists. So for today's session on environment and COVID-19, opportunities and challenges, we have with us two very eminent speakers, Dr. Rakesh Kumar, Director CSIR NEERI, Dr. Arun Kumar Sharma, Director and Professor Community Medicine, University College of Medical Sciences with us. Friends, you will be very glad to know that I'm really
Dr. Radha, we are not able to hear you well.
okay. Mic was off in between. Now, are you able to hear me?
Yes, we are clear.
Oh, yeah. So I was just sharing that it's a moment of great pleasure for me to share that Dr. Rakesh Kumar and Dr. Professor Arun Kumar Sharma both are the founding members and governing body members of SIE. And now Dr. Sharma is the president of the Society for Indoor Environment. And both of them will be enlightening us today with the knowledge and experience in this unprecedented time of COVID-19. I welcome you, both of you, sir, on this morning. Very warm welcome to both of you. And now I would like to hand over the session to Dr. Priyanka Gulshrestha. She will be the moderator for today's session. So over to you, Priyanka, please.
Thank you, Dr. Radha Goyal. And I will all the participants from across the country for being with us and supporting us in this very good initiative on environment and COVID-19. Before I start, I would like to thank you all on behalf of Society for Indoor Environment, which is a policy think tank working in the field of environment and indoor environmental quality. I am pleased to inform you that we have participation across the country like Thane, Ludhiana, Coimbatore, Agra, Calcutta, Mumbai, London, Bilaspur, Tiruchirappalli. I may have missed some, I regret that, but we have an endless list. I am very thank you for joining us today. Before we start, I'll just start by a small saying that we say that, nothing begins and nothing ends. That's not paid in mourn. We are born in another's pain. We perish in our own. This is the condition that we are facing today in these COVID times. Every individual is fighting to understand how to go out, how to transition from the lockdown times of 4.0 to unlock times of 1.0. So today's webinar is actually aimed at making you understand that when we transition to unlock 1.0, what should be our roles and responsibilities as individuals, as community, and as scientists, and how we should go ahead brushing aside all the myths and fallacies surrounding COVID-19. Before I start the session, I would just want all the participants, I request all the participants to follow certain instructions for the smooth running of this webinar. First of all, I request you all to please go on mute and make sure that your webcams are off for a seamless webinar experience. Next, if you have any questions, and I'm sure you will have many of them, for our speakers, we have a dedicated session of 15 to 20 minutes at the end of the webinar. So please make sure to type those questions in the chat box with your name and your organization, which will be asked when the speakers are through with their presentations. And last but never the least, all the registered participants will be getting an e-certificate for this webinar. So with this, I would like to hand over the webinar to our first eminent speaker, Dr. Arun Kumar Sharma, who is a professor in UCMS, University of Delhi, and he is the director professor in the Department of Community Medicine. Kindly take over, sir, Professor Sharma.
Thank you, Dr. Priyanka and Dr. Radha, for taking this initiative of conducting webinars. And on behalf of Society for Indoor Environment, I welcome all the participants today on this very important and relevant topic that we have been discussing almost everywhere. I know there is overload of information because of this. And before I begin, I also welcome and give my greetings to Dr. Rakesh Kumar, my senior, my mentor in the field of environmental sciences. So not wasting any time, let us come to the topic. The relevance of today's seminar or webinar is more in terms of that we are in a transition phase as far as our fight with the COVID-19 disease is concerned. From 23rd March onwards, we were in a lockdown mode where we have tried to prevent all activities that could promote or increase the spread of the disease, and we have done a very successful job till 31st May in containing the number of cases. And immediately it comes to mind that more important and more relevant is that the fatalities, the number of people dying because of this disease has been kept to a very low level comparable to other countries. Now, the scenario has changed. Now we are moving from the lockdown to unlocked mode. What does that mean? How does it change our individuals' perceptions and as communities our responsibilities? That is what we need to focus upon, because this is the way things will be in coming times till we win over COVID-19, either with vaccine or with treatment or with both, because miracles are only thought about, miracles don't happen. It is only our efforts in finding vaccines and treatment and our responsible behavior that will see us through this crisis in a century. So to begin with, the point that is most important here is to see that the virus, the challenge of the virus is not restricted to individuals, it is not restricted to communities, it's a matter for the entire planet. And every component, every conceivable component has a role to play in our fight with the disease. So we will see how that is relevant and how that happens. So I start with what are our individual responsibilities in the change scenario. Previously, during the lockdown period, we were forced not to go out. We were forced to behave in a certain manner by the government rules. With easing of that obligation, that legal obligation, mandatory obligation of keeping ourselves indoors has gone. That means we are free to go out, we are free to do most of the things that we want to do, and we'll be freer with coming times more and more. So what does that mean? It means that now the onus or responsibility of protecting ourselves from contracting the disease and the consequences of the disease solely lies with us. The system, the governance, the administration is not that much responsible anymore. So we have to take responsibility for ourselves. How do we do that? We do that by promoting responsibility responsible behavior. This is very important to understand. What will responsible behavior mean in these times? How we have to change ourselves to become more responsible in our fight with the disease. And finally, practice. What should be practiced? How do we practice the right and the beneficial activities so that we remain protected in spite of the ever-increasing threat because of the unlocking of the system. So, again I reiterate, all of you know this, but it's a time to revise that how does the disease transmit? There has been changes in our understanding in last 3 months that how the disease is transmitted. We were almost paranoid about the fact that touching any surface, any object is likely to transmit the disease, and that means it's a fatal condition. But a week ago, Center for Disease Control's USA Atlanta had revised its directives or its guidelines regarding the mode of analysis. And now, after evidence has been generated, we have come to believe that droplet-based transmission or transmission from objects, for example, handling a certain item, be it a cardboard or be it a paper or be it a file or any objects like a laptop or a mouse or a pen or anything, the chances are not as high of the disease being transmitted through these routes as it was thought earlier in the earlier days of the pandemic. That does not mean that the risk is eliminated, but what has been observed over a period of time, that they are not the most important source of transmission of the disease. So, what is the most important source of transmission of disease is that coming in close proximity of a person who is carrying a virus inside his lungs, inside his body, and frequently or repeatedly expelling that virus into the atmosphere by the act of talking, by the act of coughing, by the act of sneezing, or by any expiratory means when with air the virus is coming out. Once the virus has come out into the air, the larger droplet particles will automatically settle down. But those particles are of 500 micron or larger diameter. But the diameter of the virus, please remember, is only 0.14 micron. That means even a 1.5 micron suspect particulate matter, which is our prime target in air pollution issues, and the PM10.5, PM10, particulate matter size 10, they are large enough, like a football for an ant. What is a football for an ant to carry an ant? These PM2.5 and PM10 particles are big enough to carry the virus on their back, or on their body. And these particles are not droplets, so do not drop down within a distance of 2 meters. They remain suspended and they remain airborne for a long period of time. And people who come in contact with these airborne particles are at risk of inhaling those viruses inside. So this concept has to be changed, that the disease is primarily transmitted by droplets. It is transmitted by droplets, but the primary source is coming in contact with the patient, in proximity of a patient who is carrying the virus. And the added burden is that all those who are carrying the virus inside them are not symptomatic. By that I mean that everyone who has got the SARS-CoV-2 virus inside the body is not coughing, is not sneezing, is not having high fever, is not having headache. He is simply going about his life normally, as if nothing has happened. Yet he is carrying the virus inside the body and equally risk of transmitting the virus into the air like a patient or a person who is already having the sign and symptom. So, in the unlockdown perspective, when we are going out, we are interacting or we are coming in close proximity of the people who are otherwise not looking like the patients, not looking like having the disease, yet carrying the disease within them. That is where our individual responsibility in terms of responsible and safe practices become more important. Having said that, the only way to control the disease at this moment is to prevent transmission. What lockdown did was preventing the transmission temporarily. The purpose of lockdown was not that at the end of the lockdown the disease will go down. It did not happen in any of the countries. But it definitely could be reduced in its intensity in terms of its magnitude by breaking the chain of transmission. Unfortunately, in India, this has not happened. In most of the countries countries where lockdown was implemented, be it China, be it Italy, be it France, or be it Iran, or other Western European countries, in the lockdown period there was a peak of the disease, and the lockdown opened when there was already a decline in the number of cases. And then once the unlock was done, gradually there was no second peak so far seen. That means lockdown has been successful. But in Indian scenario, if you have been following the number of cases that's rising, you will see that after 31st May, still the curve is going up. We have not been able to achieve the objective of lockdown of flattening the curve. And the break in chain of transmission has not been possible for very obvious reasons, but it needs to be spelled out that we are the country which are larger in size, larger in population as compared to all the other countries that I named earlier except China. And the diversities of human behavior, the cultural practices, the social norms, our interacting behavior has been very different in different parts of the country. And that is reflected in the fact that you see that in European countries, for example, in France or Italy or Spain, the disease has a uniform pattern across the country. But in India, we have countries within the country like scenario. For example, Maharashtra, Gujarat, Delhi, Tamil Nadu. These are the states which have got maximum number of cases. And then there are states which have got only 2 or 5 or 10 cases in last 6 weeks. That means what? That there is a heterogeneity in terms of response to the disease, and that is primarily reflecting on our behavior, how we are conducting ourselves and individuals and as communities to tackle the situation. That's why we are seeing such diverse trajectories of the disease, of the infection in different states of the country. On one side, we have example of Kerala, which shows that how effectively they have been able to bring down the transmission. There has been example of Karnataka, which has done better. And on the other hand, the other states we said. Unfortunately, and there are a set of states where the disease transmission has not been big enough so far. But with the internal migration, with the movement of a large number of people because of their work-related issues or loss of job or intention or desire to go back to their homes, has caused a massive migration into inside the country. You have seen that. The effect of that is likely to be visible now. Unlocking the country, along with that, having people dispersed all over the country from the hotspots of the disease is going to manifest in the form of the disease now. So this is the time when we have to act more responsibly, more carefully as far as protecting ourselves, our family members, and our community at large has to be protected with respect to the disease. So, what is going to happen? More risk of close encounters in public places. For example, in Delhi, the buses are plying now. The buses are available, people can ride into the buses. What has to be seen is that when we are boarding the bus, are we maintaining the right kind of social distance? Are we maintaining that social distance when we are riding a bus? Are we maintaining that social distance when we are queuing up for milk in the morning? Unfortunately, or more seriously, when free food is being distributed to the hungry people who have not eaten for 2 or 3 days, is it really practically possible to expect them to maintain a social distance and calm when we have not eaten food for 48 hours or 72 hours? These are more important practical challenges which expect us to be more patient and more concerned and more responsible in our behavior. And that requires collective effort from every individual in participation. The fault may not lie only with the person who is queuing up. The fault also lies with the person who is supposed to enforce the social distancing within the queue. And unless both of them come together and take their responsibilities and act accordingly, it's not going to go away. It's not going to help the cause. The same thing I want to highlight about other preventive practices that are important in this scenario. Those are, for example, I'll come back to the transmission, the diagnosis and treatment issue a little later. Now, quarantine and isolation are initially they were practiced by the government. Government was putting people into quarantine in institutions. Isolation was being practiced in the hospitals. But with the rising number of people who require quarantine, rising number of cases who require isolation, it is simply not possible for so much of population to provide institutional quarantine and institutional isolation. artificially along with that is that 85% of the people who have the disease are either asymptomatic or have very mild symptoms, thereby meaning that they can be isolated and taken care of within the comfort of their own home, provided they know how to behave responsibly in those situations. Therefore, quarantine and isolation is now our personal responsibility. So if I get the disease or I have come in contact with a disease patient, I should not try to hide myself. I should not try to suppress the information that I am positive out of fear that there may be social ostracization or I may be forced to go into isolation or quarantine by the government machinery. That is not the fact. The fact is that once you have contracted the disease, you are likely to spread the disease in the community, and who are the first people who will get the disease from you are your immediate close family members, your most dear and loved persons. And you will be responsible for transmitting the disease to them. Having said that, the onus lies on the fact that if I know that I am positive, if I think that I am at high risk of positive, I have to quarantine myself, I have to isolate myself, I have to practice all prevention related behavior so that I don't become a source of transmission of disease to the other people. And that is why personally motivated quarantine and isolation as they need be are more important than any government machinery or any authority or healthcare worker trying to force us to practice that. Having said that, I want to come back to these two important issues about diagnosis and treatment. See, there are a lot of myths and fake and corrupt practices are unfortunately going into the community. The only way to diagnose the disease is by taking the swab from the nose and the throat with the help of a swab stick, and it is examined by a test that is known as RT-PCR. It is examining whether the RNA virus of the COVID is present in our throat or nose or not. Okay, that's the only way. Unfortunately, anecdotally, I want to give you an information that one of my staff in the college, his mother has got symptoms of fever and headache, and he is worried that his mother may be having the COVID-19 infection. It is a story of Delhi. He went to a hospital, I will not name, in a private hospital, and he was told that you have to come with the diagnosis report, otherwise we will not admit your patient. So he goes to a lab and the lab refuses to do the diagnosis. So he goes to the another lab, and the other lab says, yes, come to us, we will do the test for rupees 1500 only. Whereas we all know that the cost of the test is 4500 rupees, 4500. So he goes there, and then what do? They perform an antibody test, a rapid antibody test, and tell him, look, your rapid antibody test is positive. They do not explain to him because he is a staff who is not very educated. He has just been educated up to class 12 and does not understand. And he believes my mother is COVID positive. So when he called me up on the phone and he said my mother is COVID positive, I said send me the report. And he sends me the report of the antibody testing. And then he explains that they charge only 1,500 and they said, look, this report is saying this is COVID positive. Now look at the lack of ignorance, the lack of awareness of a person who is a staff in a medical college. And he does not know how to differentiate between a test being done for RT-PCR or a test is being done for antibody. And then he is being made to go round and round in different hospitals for not getting treatment for his own mother. This is what the real scenario has come. And that's why I am telling you that the test that will confirm that the person is suffering from COVID-19 is only the RT-PCR test that is performed on the swab taken from the throat and nose. It is not on any blood sample or any other sample. X-ray, or for that matter, besides X-ray, for example, CT scan or ultrasound are not going to diagnose. So don't fall prey to such false information that it can be diagnosed by blood examination or CT or X-ray examination. This is very important to understand. And another important point now, because there is an unlockdown, now everything is opened up, people are desperately trying to get themselves tested even if they have signs and symptoms or they do not have signs and symptoms, because asymptomatic cases are occurring. As a result, there are long queues that people have to wait. Now the waiting time is increasing. If you give your sample today, the result may not come for 5 to 7 days. So what to do? In that condition, my only humble request is don't panic. If you do not have a comorbidity, if you do not suffer from diabetes, hypertension, coronary artery disease, then the chances of having a severe infection, a life-threatening infection are extremely low. and especially if you are younger, below 50 years of age and do not have any of these comorbidities, in maximum probability is that you will have a mild disease, you have mild signs and symptoms, and you will automatically recover from that. So don't panic if you are not able to get a diagnosis. If you think you have signs and symptoms and diagnosis is not available, isolate yourself and practice all responsible behavior related to isolation, distancing, and using the personal protective equipment, and you will be good enough. This is very important. Another important issue which is becoming controversial is the treatment. Unfortunately, non-peer-reviewed scientific articles which are supposed to be published in scientific journals, interpreted by the clinicians and doctors and policymakers, are finding places in the public media. Newspapers have now started quoting from manuscripts which are not reviewed, which are not yet published, and they are trying to publicize. Half of the stories will say hydroxychloroquine is the drug of choice, go for treatment using hydroxychloroquine. And 5 more stories will appear on the same day in the same space saying hydroxychloroquine has been proved to be ineffective. Now, this information is for consumption of the doctors, clinicians who are going to make judgment. You and me as individual citizens who are not experts in the subject are not supposed to take a call whether I should take hydroxychloroquine or not. This is a very unfortunate practice of the media that is confusing people more than informing them. It's deviation from the responsibility and the role. So, let me tell you, officially, we still do not have a drug which has found a cure in COVID-19 treatment. Be it hydroxychloroquine, be it plasma therapy, be it remdesivir, or for that matter, any medicine, we do not have sufficient evidence yet to say that we have found a cure. Therefore, use of these medicines are only restricted under medical guidance. Please do not go and buy the medicines from the drug store next door and paying a hefty premium for that and start taking the medicine on your own. This is not going to help you by any means. Okay, that is about the treatment. Wait for the right treatment to come, then only it will be possible to do something. Having talked about quarantine and isolation, the most important tools that we have in our hands are 3: mask, gloves, sanitation, and social distancing. About mask, I only want to say one thing. Please wear the mask in the correct manner. Everybody wears a mask, but I find some people who are wearing the mask below the nose is open. That's not the right way. I find people when they want to talk, they pull the mask down and put it on the chin. You are not supposed to protect your chin. And if you put the mask on the chin, it is not going to protect you from the disease. Please remember, if you have mask on your body, it has to cover your mouth, it has to cover your nose. Otherwise, the mask is irrelevant, it does not serve as purpose. Okay, basic, simple, 3-ply surgical mask is good enough to protect yourself in maximum circumstances. Only when you are directly dealing with a patient, known patient of COVID-19 in close proximity, like if he is in your home, then you need probably 2 layers of mask or 1 N95 mask and 1 disposable mask together. Otherwise, in routine circumstances, routine scenarios, 1 3-ply surgical mask is good enough. Yes, now there are cotton masks also available which are of reasonably good quality. They can be used and they are reusable. That is the good thing about them. But please don't wear your mask with below the nose, or don't wear your mask on the chin, or you need not pull your mask down when you have to talk. And the most dangerous practice is repeatedly touching the surface of the mask. Because the mask, if you are the infected person, the inside of the mask, the inner surface of the mask will have the virus. If you are moving around with people who have the infection, then your outer surface of the mask will have the virus. So if you touch those portions, then the virus will come on your finger, and then if you touch any part of your face, you are likely to get the infection. So the correct usage of mask is more important than using the mask altogether. Gloves are a good protection system when you are using disposable gloves, and once wearing the gloves, remember, as long as you are wearing the gloves, with the gloves do not touch any part of your skin, any part of your face. And these gloves are disposable. After single use, if you have taken them out, particularly I am talking about the disposable gloves, the surgical gloves, throw them away. The mask and the gloves should be thrown in a covered dustbin and nowhere else. Don't be a little greedy, take one mask and worn one. Let me use it, it looks good, it looks clean, let me use it again when I am going out. Please don't do that, you are increasing the risk of disease transmission and a false sense of complacency with that. The other option we have is frequent hand washing. There is no substitute for frequent hand washing. Do hand washing with detergent, with soap, as many times as possible. Whenever you have a risk, you thought that you might have done something, best thing is to go for a hand wash. A proper hand wash for 20 to 40 seconds by the methods which already you know because it has been so well advertised everywhere. Hand washing is the most important thing. Only in the condition when you do not have a hand wash available, then you go for a sanitizer. Now, in societies, in individual offices, some places I have seen the practice of diluting the sanitizer and putting the diluted version. That again defeats the purpose. Minimum 60% concentration of isopropyl alcohol is required to be effective. If we cannot do that, then forget it. Then you are simply complacent. If you are using 30% or 20%, and for cost cutting, if you are diluting your sanitizer, you are defeating the purpose. It will not serve the purpose. So it's an appeal that for cost cutting purposes in public places, if you are keeping the sanitizer, keep it with minimum 60% by isopropyl alcohol concentration. Otherwise, don't keep it. Let individuals carry their own. At least there will not be a false sense of complacency that I have used sanitizer and I am good enough. This is an important responsible behavior that has to be practiced in offices, in apartment buildings and all other public places where large number of people are going to gather. These are very important scenarios to be taken care of. The last point I want to make before I conclude is social distancing. We are, the Indians as a culture, are not into distancing. We are more into proximity. We believe in physical proximity. So, the practice of practicing social distancing is a far-fetched idea for us. In households, in the families, in homes, or even among friends, being together is the way. This is how we have lived our whole life. So suddenly maintaining that 2-meter distance looks very awkward. But the reality is to fight the disease, we have to do it no matter how close, how personally known that person is to you. It's a question of your and their lives. So please maintain that distance. It has a lot of meaning in it. Even if you are wearing masks, even if you know you are not having the disease in you, maintain the distance. For breaking the transmission of the disease is very important. And that has to be practiced collectively. If a grocery store is open and I can see 20 people are inside, then the social distancing obviously cannot be maintained. If a bus has come to the bus stop after 30 minutes and there is a queue of 200 people and the bus will carry only 30, so we have the tendency to rush into the bus because we want to get into first. The very purpose of social distancing will be destroyed there. And that is where I believe that government machinery, whether it is the police or it is the doctor alone, cannot fight. Remember, we are 1.32 billion people. On that, 5% of the healthcare workers and all other collective forces cannot enforce social distancing, cannot enforce rules. We have to be, every 1.32 billion, every one of us have to become responsible for our own behavior and spread awareness to those who do not know and make them practice the behavior without feeling shy about it. These are the important issues that we need to take care of now when we are getting into normal life with everything thrown open and responsibility of our life is rested in our hands. Thank you very much. I would like to stop there and have the questions.
Thank you, Dr. Sharma, in moderating webinar, and I'm so sure that all the participants would have gained from it, and there are a couple of questions which I can see in the chat box which we'll address to after the next expert's talk. So please stay tuned. Our next expert is a person par excellence, a scientist par excellence, and a person par humility, Dr. Rakesh Kumar, Director CSIR, NEERI, Nagpur. Over to you, sir.
Good morning to all of you, and with excellent presentation from Dr. Arun Sharma, I'm going to be a shadow of what he has been able to do. Thank you, Priyanka and Radha, for this excellent organization. I'm just sharing my slide and then we'll start. Just one second. So, just starting with the whole idea, I was actually asked that what is that all those who are professionals in environmental field and other researchers, what is that they can do? And this was actually a very daunting statement and task which was given to me. The whole idea of work in this current situation is that except doctors who are actually in very close proximity of doing certain things, we find ourselves almost in an isolated condition. And therefore it's very important that what is that which is happening across the world, and as well as what is that we can do today. So I just want to share some thoughts and take another 10 minutes or so, and if there are any questions we can always take it. So when you look at research areas, and when I say research area, these are also opportunities for businesses. So what are the research area which I thought I have listed about 14 of them, but there are many which one can look at. Now when we get into this area one by one, the first one of course comes in environment, because most of this transmission which Dr. Sharma talked about actually happens in environmental mediums. One is air, and the second one, when it falls on the ground, it gets carried away. And of course then you have certain things on your mask and the gloves and related things. Then the transmission happens. And in hospitals as well as the places where quarantine happens, these are the again areas where the transmission happens. So these are the places where one has to actually do research to understand how far it goes, how does it go, and how much time it remains there. So that's one part of work that is going on across world. The second one is prevention, which Dr. Sharma very well documented, but prevention from a very different angle. Depending upon the cultural practices that we have, one could actually think of designing certain things, which you must have seen in some other places where how people should maintain social distancing. For example, in Paris they started a restaurant with partition glasses from here and there. So those are second area. The third one which we talk about, waste management, is the most critical thing. The workers who are dealing with all the solid waste and the liquid waste, they are actually at risk. But besides they being at risk, what is the risk transmission? How does it happen and how we can prevent it? So that's an area of work, and particularly for our country where we don't do the way other countries do it. We do most of it in an open system. Transportation also happens in open trucks, open vehicles, and therefore it's a challenge of what kind of system we design so that it works out well. We all know we use plastic in a big way in our social and system of working, and this system of plastic which is being used, how they are getting disposed or how we should be using it. That's another area. There's a whole lot of discussion which is going on with regard to how the wildlife are going to get impacted because of pandemic. Now wildlife actually here means biodiversity and wildlife together, because you must have heard all of these news saying that after the pandemic the wildlife has regained space, and the regaining of that space is a basic thing that we should be looking at. And how does that happen? The fact of the matter is that there is no data, there is no credible information which is in place which says how much of that has happened and why it has happened. We understand physically that yes, our water system is looking much cleaner, our air quality is looking cleaner, but is that impacting our biodiversity and related things? The sixth one is exposure to hazardous substances. Now that we are using a lot of disinfectant and disinfectant of all quality. Some of them are certified, some of them are not, and in many places it has been seen people don't even know what is the concentration that we should be using, right? And therefore it is important that we understand when it is being used and when it's being disposed, how is the whole thing happening. The third one, the seventh one, air pollution, we all know Delhi people are experiencing much better air quality now. You can see Himalayas, you can see a lot of other things. But I know this is also an opportunity for researchers that what is that which was causing so much of haze? What is that which was resulting from which particular sector? So when we come back to normal, which are the sectors that we need to control and which method to control? So lockdown is not going to be a final thing all the time. That's not the way to improve air quality. So when we get our vehicles back, when we get our industries working back, when we get our other activities back, how air pollution system can be still controlled and managed. Biodiversity, I already told you that if we keep creating problems of the kind where people have to use different kind of material, people will not start going into the areas, the people used to go and see tiger. When that doesn't happen, money doesn't come in, then how do you maintain all these kind of things? There's an area which is not a research area, but it's important that there are many banks which used to give money to industry which are into sustainable manufacturing. Now suddenly all that funding will reduce. It's expected that it will reduce because our GDP for our country as well as for many other countries is going to go down. And in that situation, what actually happens is that these finances will become very limited, and when the limited financing happens for sustainability, is that our environment gets affected, and that's something which is very important to study and think about. The 10th one which you see here is pushback on environmental laws. There are some needs which started coming in that because our economy is going down and will go down, there are people who are pushing that our environmental laws should be made less stringent, meaning we should have more I would say leeway to pollute more, for producing anything or for doing anything. And that's something which is going to be a big challenge. And there are people who are looking at it, those who understand environment and those who understand law. They need to be looking the economic fallout and the long-term fallout on the environment if the laws become, I would say, relaxed. That's what is being discussed. Water, no-brainer here. I'll discuss a little later. Water and wastewater are very connected system. Greening of economy, people are talking about how do we do it. Can we use green chemistry? Can we use green engineering? And all of these green work actually means that you produce something which you need. You don't produce something which you are wanting to throw. So the whole idea of single-use plastic, can it be extended to single-use any material, any product that we are using and we are likely to use. In climate action, I will discuss a little later again. You have a lot of these climate greenhouse gases which are reducing, but if they are reducing because of anthropogenic activity, how much of that is contributing or not contributing? Because climate action is also linked to finances of people in different countries. And once we know that, the chances are that we'll be able to do a good research in climate related action. Last one is livelihood. You all have seen it, the way livelihood got lost. We have to think very differently what is that which we should do so that the employment comes back. And every livelihood, environment and funding opportunity are actually linked. It cannot be isolated in a very different way. So there are many areas, and all those who work in this area, they can actually combine their strength and move forward. So just would like to share with you what is that which is being done by a lot of people elsewhere. So if you see the statement which has been made by Professor Russell from University of Arizona, he is saying there is a global experiment going on in our atmosphere. What actually it means is that the processes in the atmosphere has suddenly started becoming different. And what we need to right now do is to collect more and more of that data so that we are able to come out with conclusions which are important. And in no point in time, no way, and in no other conditions, we could have created, at least scientific people could have created a scenario of everything getting stopped and measure it. So that's why when you all of those who work in climate models, you will know that they have worked on social and development scenario. So it's scenario B, B1 and related things. But now what do you do? That's not part of the game. Pandemic was not part of the data earlier. So when we are determining the impact on environment based on what is happening right now, chances are that we'll be able to study the human health impact much better and then link with pollution and air quality, which is a common thing that we talk about. The one which you see on the right hand side, there are a lot of people who are watching the sky. That what is happening if airline traffic is reducing so much, what happens to the cirrus clouds? What is happening to the lower altitude clouds? If you look at Delhi and Mumbai together, they were having at least 5,000 to 6,000 takeoff landing every day. Compared to that, now you have 25, 30, which has just resumed. And in between, what was going on? There are also people who are looking at as a research problem that what is the kind of solar energy which is reaching the surface, and if it is reaching, what kind of what kind of advantages happen? Because you have less particulate matter in the atmosphere, so different kind of solar energy, a different extent of solar energy is coming down to the earth. Some of the work that people are doing, people are trying to look at global climate model and see how much of that can be measured using new methods. So the typical one is in greenhouse gases, you have human and natural activity both, and they get mixed. Now that they are there in atmosphere in a different way, anthropogenic activity being very, very low, how do you differentiate between these two? And therefore, whatever earlier we were doing in terms of modeling and assumptions and computing, we can actually do all the validations required. So there are teams, for example, here in Connecticut, who are flying over an area and trying to assess air quality and greenhouse gases. Similarly, there will be online gas chromatograph and mass spectrophotometer who are actually looking at that during COVID time, what is the air quality which is happening because of reduced human activity in the local air quality. Sorry. I'm sorry about that. Right. So what is that environmental engineers, scientists, what they can actually do, what kind of study they can do? So if you look at, these are the areas of work which some people have already started. For example, fate and transport and survival of viruses in the different situation of air quality, temperature and humidity. Similarly, survival on surfaces in different conditions. If you see the data which came from Europe and the US, most of the data we said that virus survives to this extent and that extent on different surfaces, but the maximum range of temperature that they did in their experiment was not going beyond 27 degree and 30 degree centigrade. Whereas in our country, we experienced temperature of 45, 48 varies in most of the places. So what happens on those surfaces? And when we have those surfaces, are people actually getting exposed to it, right? So this is the kind of work which is not happening. Some work we have started on sewage and water interaction. So if you see all the literature of many other countries, they are saying the survivability of the viruses in water is not yet proven. And most of the places in sewage treatment plant, they have taken adequate care, and therefore they can actually be able to do certain things in a particular way. Now, when we do this assessment, we realize that in our urban area, sometimes our sewage water gets mixed with fresh water. No study as of now, we don't know. We are not trying to scare people, but it's important to understand that if there are areas where we have high concentration of people living in that region, then there is a chance that there is a possibility for COVID spread. So these are some of the things which are known, which Dr. Sharma has already talked about. But how do they actually move in the air, water, and soil medium is not something which is known, and that's where the research can actually happen. So these are the areas of, I would say, businesses as well. That if a contamination happens, how do we take care of risk and how do we prevent it? How do we take care of ourselves into air, indoor air, which could be car, bus, metro, classrooms, is spread and control. There are a whole lot of people who are talking about that. Can we not have our own, gas system and related systems, which can be worn, and it's a wearable device which will be free. And then we can have something like non-contact disinfection system. And solid waste disposal, as I said, is a very important area. So how do we do it in a secure manner? Right now we do it in a very open manner. The other area of research is cost-benefit analysis of each and everything that we do. What are the approaches we should take to solve problems, parts or together? And what are the environmental law safeguards? Right now, some of the environmental law will find it very difficult to get applied, right? So how do we control all of them together in safeguarding on this? And therefore, it's very important that we have a multidisciplinary approach. So those who understand environmental engineers, they actually work outside of the course. They work in environmental science. But whereas virologists will understand what's cells, what's going on, public health scientists will tell you how the exposure happens and how it gets spread in communities. Policymakers will talk about the complex decision making. So all of these together actually would happen in slowly, and we will actually evolve ourselves. So in conclusions, every sector we have to start doing a new thinking. Delivery industry, particularly when we do food delivery, material delivery, or anyone meeting anyone at any place, big areas of innovation is required. And for doing all of these, the assessment and compliance become key. And once we do that, the chances are that we'll be able to live in this community better. As Professor Sharma again pointed out, we are used to staying closer because of population density and probably cultural issue. But we need to now behave differently, and if at all, then what do we do and which way to do? And therefore, we need to have a new system in place. It will not only be driven by culture, but how that culture is combined with engineering, combined with practices and safeguards, which will make us safe. So I'll stop here. Thank you. I hope if you have questions, I can take it.
Thank you, sir. Thanks a lot for your such interesting presentation on what actually, as environmental scientists and engineers, how can we actually contribute in terms of research. And I am so sure that our young minds attending this webinar will surely have gained from a lot from this. So I will now move on to the question and answer session. We have few questions. I'll start with Dr. Rakesh Kumar. Sir, we have a question talking about what are the new approaches in phytoremediation in abating water and air pollution. Any latest study by NEERI in this regards by Mr. Hazarika?
Yeah. So when it comes to the transmission area, particularly when we talk about the particulate matter also can carry some of these viruses. Till date, the approach has been that in hospital areas you wear mask and you save yourself, or in hospital area you also do disinfection related things. But can we do passively as well? Can we start sucking in air in the whole area so that we in testing area and operational area maintain positive pressure? But there are other areas like lobby area where a lot of people come. Can we create negative substance so that the air is replaced all the time? So that's one area that we are working on. One small system has been placed in a hospital near Nagpur, and we are trying to see how effective they are. So that's one work which is going on. On water and sewage related aspects, there are some reports which says that if your sewage shows COVID-19 or viruses, it also shows which are the area where you have cases. It's a very indirect way of looking at it. So that work has just started. We have started taking samples from different parts of few cities. It's not easy to work during this period because of lockdown. And the third one which we have started is we have done extensive sampling of Ganga and Yamuna during this period to actually prove how much of reduction in pollution load has happened because of lockdown. So let's see results at the end.
So we have very noble approaches adopted by NEERI, and I have been apprised by Dr. Rakesh Kumar on this. I'll move on to the next question. That's by Mr. Ravi Gupta. Is bees nesting and multiplication has improved? If it is so, it may be a good sign of survival of healthy ecosystem. Sir, it's for you, sir, Dr. Rakesh Kumar.
So that's something which everyone has seen, right? So if you reduce your air pollution, reduce noise, nesting and all that always improves, right? But it's also to be seen. We should not become too cynical in the sense that we should have lockdown situations so that the environment survives. Mankind has survived only because of the balance. Every time when population has increased or people have moved, they have gone to agriculture. So we have now got evidence which actually says that you can possibly live in a way that both can happen. So you will have nesting as well and survive as well.
Great. Thank you so much, sir. We have an array of questions. Next question we have from Mr. Sadgir is, how can virus COVID-19 can be detected in water treatment? So what is the removal method for viruses in water treatment?
So in water treatment plant, if you see the whole processes, you have a primary treatment, and after that you have filtration, and then you have chlorination. So these processes will primarily filter it out. Funny thing is, the chlorination that we do in a normal time, it is to maintain 2 ppm of chlorine as a residual chlorine. If we are able to maintain that, the chances are that the viruses and bacteria will not survive. But we all know that many places where water is supplied, we are unable to maintain that. So that's a risk. In fact, we wrote to some of the pollution control board and authorities that you can actually do extra chlorination during this period, the way you do during monsoon times, just to make sure that the survivability is little less. Chances of contamination is much lesser. If Dr. Sharma wants to add something on this, if higher chlorine level will be able to kill bacteria, because bacteria, of course, yes, but virus we have no idea. It's just that we assume that it will be acting in the similar way.
Yeah, for virus also we are using the sodium hypochlorite solution 1% that has been found to be effective. So chlorine-based bleaching or chlorine-based treatment is the only available solution, because the other ones, like in large water treatment plants or waste management plant, UV rays or any other mechanism is probably not feasible. But 1% sodium hypochlorite solution is good enough for even 30 minutes of contact will eliminate the virus from there.
Right. So the water treatment units are fairly safe as of now. That's what it is. Yes.
Thank you so much, sir. We have another question from Mr. Reddy. Is, apart from PM10 and 2.5, any research is going on another sizes like PM1 or less than 1?
At least we are not doing it. There are other researchers in other countries. They may be involved in it.
Right.
Yes.
Thank you so much, sir. The rest of the questions, I'll want you to be with us for a while, Dr. Kumar, as we take on some questions for Dr. Sharma. Sir, the question that I have got from Ms. Devyani Patil is that please mention the name of the COVID-19 test again.
The test is called RT-PCR. RT-PCR stands for real-time polymerase chain reaction. Real-time polymerase chain reaction, RT-PCR is the name of the test. The test is performed on the secretions that are collected in our throat and in our nose. So with the help of a swab, we actually collect the mucus or the liquid secretions from the throat and nose, put it in a viral transport medium, and it is taken to the laboratory where the material is actually subjected to some nucleic acid binding. It primarily contains an RNA. So the RNA binds with its antibody in a polymerase chain reaction test, and we see whether the nucleic acid material conforming to the RNA composition of the virus is present there or not. The test is called RT-PCR, real-time polymerase chain reaction test.
Thank you so much, sir. This is from our speaker only, Dr. Kumar. He's asking that if we wash masks and gloves with soap, can it be reused?
Yes, there are two types of mask available. One is which are reusable, especially the cotton fabric masks. They can be cleaned, washed with detergent, dried and then used again. But the disposable mask, the surgical mask that we use, the so-called 3-ply mask, that is not a reusable mask. And it is also established that such masks, the disposable masks, are valid or good only for 4 hours. So after continuous use of 4 hours, the mask becomes wet with our own breath, the moisture in it. And after that, it is not effective anymore. and the other mask, for example, the N95 mask or KN95 mask, which is primarily used for protecting ourselves from air pollution. These masks can be reused, but they cannot be washed. For example, if you have used the mask, after that, if you have dried in the sunlight for 4 hours or 8 hours, or you have kept it in an open ventilated space for say 3 days, then automatically the virus particles on it will dry down. And if it is otherwise not dirty, then that mask can be used again.
Okay, that's an interesting aspect that we got to know about. How effective is the homemade cotton mask? That's a question by Mr. Hazarika, sir, for you.
Yeah, cotton mask, as long as the mask has 2 or 3 layers, and it actually depends on the quality of the fabric. For example, if it is 100% pure cotton mask, it definitely serves its purpose unless it becomes wet. If the mask becomes wet, either with our own secretions or with water or anything, it loses its effectivity. So this question was raised from some of my friends from Mumbai, that Mumbai has so much of rain, and in the rain, if you are going out and using a cotton mask, then obviously even if you are using an umbrella, under the rain the mask will become wet. And once the mask is wet, it loses its purpose. So you have to carry a couple of masks or many masks at a time, so that you are wearing a dry mask all the time if it is a fabric based mask.
That's an interesting fact that we also got to know today, sir. And then we have Mr. Reddy. He's asking, how will this virus impact air pollution? Does this virus exist, and for how much time?
So should I answer that, or Dr.
Yes.
Rakesh is going to answer that?
Sir, you both can oblige us with an answer.
Okay, so
I
the
think
research.
Dr. Sharma is the right person to answer this.
Okay, thank you, sir. The research so far, I would like to quote 3 scenarios. One study was conducted in a hospital in Wuhan, where the outbreak was, and they collected air samples at different heights in the ward in which COVID-19 patients were admitted. And they found that at a height of 13 feet from the ground, the air samples had the virus in it. This is one evidence. The second evidence was collected in Italy. In Italy, a couple of studies were conducted, and they have shown that northern Italy had highest concentration of cases as compared to the southern part of Italy. And the air pollutant concentrations were higher in northern Italy. So there was an indirect ecological relationship suggesting that if the area has higher density of air pollutants, then transmission of infection is higher, thereby implying that air pollution definitely increases the chance of carrying the virus in the air for a longer distance. And the third study was conducted in University of Nebraska, USA, where they have shown that the virus particle has been derived from samples of air even at a distance of 26 feet from a possible patient where he might have passed or where he might have coughed or sneezed. Therefore, it is all justified to believe with available evidences that in the immediate vicinity of a patient, when he coughs or sneezes, then the virus particle can travel longer distances than 2 meters if a mask is not worn. And that virus particle can remain suspended, piggybacking on any suspendable solid air particles. Now the question of duration, how long it survives, we do not have any evidence, because remember, virus is not a living being. Virus does not multiply on its own on a surface. The virus requires a living cell, a living human body to multiply. So the virus particle, if it remains on an object, on a surface, it will die down or not, that will depend on the atmosphere. If the atmosphere is drier, if the atmosphere is warmer, so if the temperature is more than 45 degrees Celsius, not with SARS-CoV-2, but previous SARS viruses like SARS-CoV-1 and MERS, MERS virus, it has been seen that the virus can survive for even up to 72 hours if the environment is conducive for it. But if it is dry, if it is hot, for example at 70 degrees of Celsius, the virus will not survive more than 15 minutes. So one of the mechanism of making a surface antiseptic or free of the virus is to heat with a dry heat up to 70 degrees Celsius for 15 minutes, and it will ensure that no virus particle is in a condition that it will multiply once it gets into human body. But unfortunately, not much research has been done in Indian circumstances in different geo-social environment, how long the virus will survive in air. And that is where what Dr. Rakesh showed is very important, that we need to conduct indigenous research with air samples in different environments, where we can find what is the survival and what are the factors which influence the survival of virus in different atmospheric conditions.
That's a very important point, sir, mentioned. I would say that is a research question that we really, as scientists and researchers, need to work on. The condition in which the virus survives. Coming on to the next question for Dr. Sharma, it is what are the specific do's and don'ts for this construction sites during the pandemic times?
Yeah, okay. Construction site, there are no specific additional do's and don'ts. It is the same thing. That the people who are working, first of all, people who have the disease, who have signs and symptoms, they should not be working. Be it a construction site or any site, the first thing is if you are symptomatic, there is evidence that you have the disease, please do not come to work. No matter how good or how comfortable you are feeling or whatever the compulsions of working, do not come to work. Number two, at construction site, obviously the dust is more. So chances of the virus particle remaining suspended in the air is longer. Therefore, practicing of using mask, frequent hand washing, and at the same time maintaining social distances is very relevant. If these three things are practiced, then construction site is no different from any other working condition. These rules are universal. Wherever you work, whether it is a factory shop or it is a construction site or it is a restaurant, anywhere, if you practice these three things, you wear a mask, you sanitize your hand regularly, and you maintain the social distance, then you are good enough to go.
Great. Thank you. Next question, and very relevant one, I would say, is what is the recent scenario in development of vaccine or antiviral drug for the treatment of COVID-19?
Okay, let me explain that. I'll take a little bit of time, but for benefit of your understanding, I know there is maximum anxiety about when there will be a vaccine, when there will be a drug. I understand that anxiety. What happens in case of vaccine is, there are steps of trial. Trial means you identify a particular particle on the virus surface which is amenable to be used for creating a vaccine. That is the first step. Then you take that surface and then you expose it to human immunity system and try to see whether we are able to generate an antibody, a substance which can destroy the virus. So the first step goes in the laboratory. After you identify the particle in the laboratory, you see the particle that has been created. Is it safe to use in human beings, or it can have side effects, like drugs have side effects? So that is the second step. Once it passes through the safety trial, then comes the stage of trial of the vaccine on individuals. So first we have trial on volunteers, on a small group of people. Now on that group of people, you introduce them to the vaccine and you expect them to be exposed to the risk of the disease. Then you observe them for a period of time. So you have identified 50 volunteers, you have given them the vaccine, and after that you are waiting for a period of 2 months or 3 months to see whether after being exposed to the infection they are getting the disease or not, and compare that with a control group. So once you have done that, on a group of volunteers, then you move out from a set of volunteers to a larger sample population of say 250 people, and then you wait for observation. And also keep looking for whether there are any side effect of the vaccine or not. And the final trial is to do the trial on healthcare workers or on a larger population of say 1,000 people. So when these three phases, phase 1, phase 2 and phase 3 trial are over, then the vaccine is submitted to the FDA or the concerned regulatory authority in your country to certify that the vaccine can be used. Once that has been done, the vaccine formula is given to vaccine manufacturing companies for mass production of the vaccine. And then the vaccine comes into the market. So, this gestation period of vaccine can be anything between 9 months and 15 months. So remember, in the month of January, WHO had started saying, no matter how fast we discover a molecule to become a vaccine, it's not going to be available before January 2021 or February 2021. Some of the vaccines are in phase 2 of the trial. Some of the vaccines are in phase 3 of the trial. But the other challenge is that the entire humanity is at risk of the disease. 212 nations, 7 billion of the entire world population needs the vaccine. Now tell me, which manufacturing company has that capacity to magically produce 7 billion doses of the vaccine and make it available to the whole world, to the last man standing in the remotest village or on the farthest mountain in the world? So practically, the vaccine is still a year away from coming into your hand once it is found out. That is about the vaccine. The same thing happens about the drugs. There are so many drugs being tried, starting from hydroxychloroquine, the most controversial drug, remdesivir, an antiviral drug, or use of plasma therapy in treatment. Now, like vaccine, this also has to pass through phase 1, phase 2, phase 3 clinical trial. The trials are called double-blind randomized controlled trials. Unless the trial is done, on an empirical evidence, if you start giving medicine, hydroxychloroquine is into disrepute because it has a lot of side effects. People who suffer from cardiac diseases have the risk, have the risk of developing more complications and dying. So the first study conducted in France with hydroxychloroquine showed that people who were seriously ill and given hydroxychloroquine, they actually died instead of recovering because of the drug. Then more trials came into picture. Some trials were favorable, some trials were not so favorable. So we are still do not know. So the final evidence will come only when we have reached the phase 3 clinical trial of a double-blind randomized nature, and after that the controlling authority certifies that yes, this is the drug of choice in treatment of COVID-19. We have not reached that stage yet for any drug. And then there are homeopathic drugs and Ayurvedic drugs and other drugs. I am not an expert in homeopathy, I am not an expert in Ayurveda, I cannot comment on that. But unfortunately, whether it is Tulsi ka Kada or whether it is arsenic 30 of homeopathy, whether they work or not, the scientists from those genre or those expertise have not come out with evidence as we understand evidence. Therefore, we cannot say that there is any drug available at this moment which can treat. That's the final answer for this date and this time of the moment.
Thank you so much, Dr. Sharma, because this is the information that I think all of us have been waiting for. Slightly dismal though, that it is going to take time for a drug or a vaccine to reach the common public. It is important, but at the very state, I am thankful to Dr. Sharma and Dr. Rakesh Kumar, and all, believe me sir, the kind of comments that we are getting, everyone has benefited from this very knowledgeable webinar, and we look forward to many more such webinars. For all the participants who are there, we are continuing this aspect, and then we have the next webinar session on the next Saturday, the details of which will soon be published. So I hand over the session to Dr. Radha Goel for the vote of thanks.
Thank you so much, sir, Dr. Rakesh Kumar sir and Dr. Kumar Shah sir. So such a wonderful and very enlightening session. I hope that wherever we were having a lot of, anxiety, doubts about the coronavirus, about that, how we should behave, what should the precautions we should take, what should be our behavior once we are, because this lockdown is over. So when should we, how we should move to the community. So many doubts I think everybody was having along with me, and you have really did a justice and you have really solved all of our queries. Thank you so much for such a good webinar and very interactive. And I would like to thank Dr. Rakesh Kumar for giving us the opportunities for research, the thrust questions, the research questions and the thrust areas during this COVID pandemic, that what should be the research further into this direction, that how air pollution, how water pollution will be linked with this COVID, and what should be the way ahead for the research, for the scientists. It's really very informative, sir, and I really want to thank you all participants for giving your overwhelming response, for such an interactive question session we had, and we are still continuing. We are getting a lot of questions because of the time we cannot take them up, but definitely we will revert you back with all your queries on your mails, definitely. With dealing with experts. So thank you so much, and we are looking forward for your participation in our upcoming webinar which we are planning for next Saturday. The title would be more more on air pollution and COVID-19. So even we will be discussing more about ambient as well as indoor air quality, both the aspects into that webinar. So looking forward for all of you to see there and to have a very interactive webinar as it is today. Thank you so much once again for such a good webinar, and we really want your support to take it forward. We want to continue with this for a longer time. So thank you so much once again. Thank you, sir. Rakesh Kumar sir, Arun sir.
Thank you, Dr. Goel. Thank you, sir. Thank you. I close by saying just a small saying is that tough times don't last. Tough, yes. And we go on a very positive note from here to the next webinar. Thank you. Thank you. All the experts, Dr. Goel, everyone. Thank you so much.
Thank you so much. Yeah.